I'll post the recording of the class in the announcement section after class, and then you can watch it when we're done. Is everyone able to see the screen that says orientation to online nursing classes? Okay. If you're not able to see it, just so you know, I want all of you to know, like, I'm really hard to insult. Like, if I do something that just doesn't make any sense, or you can't see my screen and I think I've screen shared, just tell me. Like, I want you guys to get the most out of this class. So just if you can't see something or something doesn't make sense, let me know. So basic information about what is online learning. So I think you guys know this. It's using the computer to participate in an educational program. So you guys are still going to interact a lot with me, and the more you interact with me, probably the better you'll do in the class. So I'll give you feedback throughout the term, and I'll meet with you outside of class when you ever need it. There's quizzes, assignments, there's something due every week. And you guys are responsible for kind of knowing what you're required to do. You're adult learners, so plan your week, make sure you get everything turned in on time. Going forward, like week 2, etc. As we're moving through, I'll post an announcement that has what's due for the week. I'll post it on Monday, so you kind of have a sense, but you should also go based on what the syllabus said. I think most of you guys have done your discussion questions, so it's your discussion questions this week, and then there's also a quiz. So just making sure that you stay on top of your homework and coming to the lecture is your best way to make sure that you're going to do well in the class. So if you ever have any issues, I'm the first person that you should talk to. And I'm going to be honest with you, I don't work full time as a teacher, so I'm not always on the internet. So I will get back to you if you send me a message in Canvas within 24 hours. But if you need something that's a little bit more urgent, you are more than welcome to send me a cell phone message. So my phone number is 208-765. Oh, sorry, I wrote the wrong phone number in there. I'm not really sure where that was going on. 716 205. Oh, I'm sorry. Yeah. So 208-765-8716. So I will respond to messages in Canvas within 24 hours. To be honest with you, don't call my cell phone. I don't answer my cell phone, especially if it's not a number I don't recognize. But if you send me a text message, I will get back to you 100% always. Yeah. Do you have a question?
I'm sorry, I didn't get the number.
It's 208-765-8716.
Okay, thank you.
You're welcome. So and it's always best, like I said, if you leave me a message, I will get the message, and I will get back to you, but I respond fastest to text messages, just so you know. And you can text me on the weekends, you can text me later in the day. If by like 7 p.m., 8 p.m. Eastern, I probably won't get back to you till the next day. But I do respond to messages. So if you have anything that you're worried about, that is the fastest way to get in touch with me. And if it's something just like a general question that can wait until the next day, you can always send a message in Canvas, and I'll message you back in Canvas. So there is like a chain of command. So I'm the first contact as your instructor. There is also a lead for the course. So it's Professor P. Her name is Patient. She's the lead for this course. You can also contact her. You can contact your campus dean, and then the online nursing education dean is Darlene Brown. So Darlene Brown's phone number and email address are here. So if you ever have really something that's urgent, you also can you can reach out to her if you have a specific issue. But like I said, I want all of you to do well. I'm your advocate. If you have an issue, you should come to me first, and I'll do my best to try to figure out how to solve your problem. And this is kind of going over that same information. So because students are from all over the country, when we put start and stop dates in the Canvas shell, it's specific time. So if an assignment is due this week, it starts Monday at 12 a.m. Pacific time, and it ends Sunday at 12 p.m. Pacific time. So for those of you on the East Coast, you have a few more hours to turn your homework in. And this is the discussion question. Again, there's several discussion posts throughout the week. So you need to post by Wednesday and then respond to your classmates by Tuesday or by Sunday. And the reason why it's 2 separate days, I've had students ask me this. So I'll give you full credit if you post in Wednesday and then respond to your peers on Wednesday. But you don't get the same credit for participation in the online course if you do it in the same day. So you really need to wait 24 hours in between your post and then the response to your peers to get credit for participating in the class. So that's part of this process with the online course, that you need to be like logging in and turning your assignments in. So the Wednesday and Sunday, if you're doing it this way, then you're going to be guaranteed to get like the credit for participating in the class. It doesn't have to be Sunday, but it should be 24 hours after your first post. So in terms of the homework, you need to let me know beforehand. So if something comes up, your kid's sick, you've had a really busy week at work, whatever the situation is, I'm going to be flexible and I'm going to try to work with you. But that's only true when you let me know in advance. So if you tell me on Tuesday when something was due on Sunday that you didn't get it in when your kid was sick, that I'm not going to let you turn it in. You need to just send me a message and be like, this reason I didn't get this done, I'll let you turn it in late, but there will be a 10% deduction and you only have a week. After 8 days, it can't be turned in. So this is, talked about, this is getting into how you get credit in the online system. So you have to be doing 2 things in Canvas every week to get credit. So one of them is your attestation, the discussion questions, the case studies, the quizzes, all of that counts for your participation in the class. So if you're not participating in the class for 2 consecutive weeks, then you'll be dropped without any notice. So that's why the attestation forms and the discussion questions are so important, because if you're doing those, then you don't run the risk of being dropped from the class. So in terms of making sure that you're successful in the class, I think it's best to have a day planner or a calendar or something where you write everything down, that you know what you're going to do. And make sure that you're clear about the assignments. If you ever have any question about what's expected or what I'm going to be grading you on, you can talk to me. I'll happy to go over it with you. Come to class, ask questions if you have any questions. Make sure you read the instructions so you know what you're turning in. And then follow up with me if you want any additional assistance with anything or something doesn't make sense. So this is kind of reiterating that, contact me as much as you feel like you need, as you need to. Stay organized, make sure you're logging in several times a week. Make sure you read the announcements that are posted. Make sure you turn your assignments in on time, and don't procrastinate. So, have a game plan and try to get all your stuff turned in on time. So I think you guys know this, because this is Friday of your first week. You guys have all been logging into Canvas. So during the lecture, I'll make sure that you guys understand the key points for what we're in the chapters. I'll give you time to participate, ask questions if you have any questions. I'm not the most tech savvy person, but if you have some technical difficulties, you can contact tech support, or I might be able to help you, kind of depending on what's going on. So it says weekly review sessions. I do not have weekly review sessions. I have class once a week. But if you want to meet with me, I'm happy to review any information that you want to go over. And there are exam reviews, and I highly, highly, highly encourage you to go to the exam reviews. All the instructors know what's on the exam. We make sure that we go over the information that you need to study before the exam. And all of the reviews are recorded, and they're sent out to the other instructors. So you can, if you can't make it, I think going to one is best, because then you can ask questions if you have any questions. But they're also recorded and posted in the announcement section, so that if you miss one for whatever reason, you can watch it. But I would definitely pay attention to the exam reviews, because they will help you out. I think you guys know this KGA, which stands for Key Graded Assignments. It's your unit exam, quizzes, and your specialty exam, or your HESI. So that total of those 3 things have to be 78% or higher, or your homework doesn't get added in. So, pretty new to Fortis. This is my second quarter teaching. I can say that last quarter, all of my students that didn't pass is because they didn't do well on their HESI. So just kind of have that out there, knowing that it's 20% of your grade that's going to come in at the end of the term. There is also a HESI review, but just, you know, stay on top of your work and make sure you ask any questions if you have them, because that exam that's 20%, it counts for quite a bit of your grade. And it's really, I mean, to me, it breaks my heart, because I had several students that, you know, if their homework had been counted, they would have passed. But if you don't have this 78% on these 3 things, then your homework doesn't get included in your grade and you won't pass the class. Does anyone have any questions on that KGA piece? Okay. And this is just repeating the same thing. So the combined score must be 78% before any credit for homework is added in. So the quizzes, like I said, your first quiz is next week, and you know, it's timed. You only get 1 question at a time. You can't go back, and you'll see your grade as soon as it pops up. So don't stress out too much at them. Most of the students do pretty well. But I would say, you know, I would probably wait until after lecture to take the quiz, because I'm going to try to make sure that you guys know what you need to study. You can take it in at any point during the week that you want to, but I do make a point of like letting you know the general areas that will be on the quiz so that you guys have the best chance of doing well. And then you're all going to take your exams on ExamSoft. So please make sure that you download your exam before you come to class. And then if you could come to class a few minutes early so that I can have time to check everyone's ID. We will come back to class after the exam. It won't be a full lecture, but there'll always be a Kahoot. So we'll always go over a little bit of information in a Kahoot game just to make sure that you're covering all the material that you need to recover. And if for any reason you prefer to take the exam on campus with a proctor, I'm fine with that. You just need to let me know in advance and I'll give your proctor the exam code. So they are scheduled during scheduled class time. You know, things happen. Sometimes people's internet goes out or something happens. You need to let me know as soon as you can if there's going to be a problem, and I'll try to work with you. But you know, unless there's something serious going on, you need to be in class to take your exam. Unless you've arranged to take it with a proctor and that needs to be done, you need to give me advance notice. I should get 72 hours advance notice if you're not going to take it during class. So missed exams are held to the same late work policy that you need to let me know beforehand. You can't not show up and then tell me you were sick. And there is, you know, you have 7 days and you'll get a 0 if it's not done within 7 days. And if you guys have any questions about that, you can let me know. And I'm always available to tutor or meet with you if you have any additional questions. So in terms of the homework assignments, like I said, I think something like this is really helpful. You know, have a calendar, you know what you have to do for that week, and you can write it down and check it off. I'm a very visual person. For something like this works for me. So whatever system works for you, really, you know, it should be the exact same as the syllabus, is what's in the Canvas. But just kind of know what's due and plan ahead and make sure that you have time to get your work done on time. So we've talked about this. You need to get prior approval. You have up to 1 week after, and then there's a 10% deduction. Thank you for asking me, Ashley Lakes. Let me look here. Yeah, you're right. So quiz number 1 is next week. If I didn't say that correctly, then thank you for clarifying. Not this week, next week. Thank you, Ashley. So in terms of this is just going over the late work policy again, that you have 1 week and there's a 10% deduction, but you need to let me know in advance that it won't be turned in. And then this is something that I had a lot of students question last time. So the NCLEX questions, you need to send me the PDF of the questions, showing the breakdown of the questions that you took, you can't send me this, you can't upload a screenshot. So the instructions are built into the Canvas, and they're also in this PowerPoint. So as long as you know how to do it, that's the only thing that really matters. But just so you know, I won't give you credit if you upload the screenshot. I'll send you a message that says, I can't accept this, it's a screenshot. Please upload a PDF, but just make sure that you do that. And the number of points you get is based on the number of questions that you answer correctly. So if there are 50 questions, if you answered 40 correct, then you'll get 40 points, which is 80%. So I obviously don't know how many times you attempted. So you can do it more than one time and upload your best score. It's totally up to you, but you'll get points based on the number of questions that you answer correctly. And then your case study and your practice exam, these are both things that are part of HESI. And there's a link in the Canvas shell to open the case studies. Unfortunately, you only get one attempt. So whatever you get on that case study, that's your score. And you don't need to upload anything. As soon as you finish taking it, it automatically transfers into Canvas and you'll be able to see your grade. So if you ever have any problems, like if something is due and you're not able to open the case study or something like that, you need to let me know so that I can help you make sure that you have access to it. But that's the only method. You have to use the link that's in your Canvas shell. You can't do it any other way. So just let me know so that I can make sure that you have access to it. So for this PN course, you don't have any papers that you turn in, but they are the discussion posts. And I'm sure you saw in the discussion post, it'll clarify if you're required to add a reference. So, I will take off points if you don't reference your source for your discussion posts. And there is, this is more information about writing papers, but like I said, you don't have a paper in this class. So I'm going to skip over that. And this is the citing style that you should use in nursing. So there should, when you cite your source for your discussion, it is ideal if you use the APA format, but you do not have any papers that you need to cite using APA. So this is just kind of reminding you that the exams and quizzes are timed. So sometimes students have accommodations where they've been given permission to have more time to take their quizzes and exams. If that's true, you need to send me a letter so that I can set up your quizzes and exams correctly. Like I said, it's actually 15 minutes. It says 10 minutes in here, but you have 15 minutes to take them, and it's one attempt only, and only one question at a time. And for the quiz, you'll see the score when you're finished. And the exam, we don't give out ballpark scores anymore. We used to tell students, you got at least an 84. So after every test, all of the instructors that teach that class meet and they look at the percentage of students that answered the questions correctly. So for example, if 75 or 80% of the students across the board answered a question wrong, then we would consider that to be a bad question. We would consider that it was something that we didn't teach correctly, or there was something in the wording of the question that made it hard for you to answer. So then we would throw that question out and you might get points added back in. So your final grade for your test will never be the day that you take it. The teachers always have to meet and kind of go over the test question among all the groups, and then throw out, almost always, we don't always, but almost always throw out a few questions. So since you guys take your exam on Friday, we almost always meet on Saturday. So the grades should be posted on Saturday after we meet. But on Friday, when you take your tests, I won't be able to give you your score because we need it to be consistent across all classes. And some teachers were giving students the ballpark score and some weren't. And we were all told that we're not allowed to. So you guys will have to wait until the Saturday after you take your test before you get your score. So for your Kaplan A and B tests, The big thing with these is that, again, you don't have to do a screenshot. I log into Kaplan and I look to see if you did the work. So you don't have to upload anything. You can add a screenshot if you want to, but it doesn't matter. I'm going to log into Kaplan regardless. And you need to do the remediation. If you don't do the remediation, you won't get full credit. So you you have to remediate on every question also. So even if you answer the questions correctly, you still need to go in and look at the information. So if you partially remediate, you get partial points. If you don't remediate at all, you only get 50%. So this is the breakdown. The questions really aren't that difficult. I'm not saying they're not that difficult. They're not that many of them. They're between 10 and 15 questions. So it's not going to be like a very time consuming thing for you to do. So I encourage you to just do them and then remediate, and I'll log into Kaplan and see how you did and put your score in. And then the HESI, which is the specialty exam. So it's taken in a proctored environment, depending on your campus. Sometimes students go in to take them, sometimes they take them on ProctorU. So you'll have to work that out with your individual campus. You only get one attempt on the HESI. So just so you know, because I like I said, I really feel for students. I had several students that were passing and then they didn't do very well in the HESI and they ended up not passing. So it's really, really important that you plan ahead, sleep, make sure you're rested, make sure you're scheduled, make sure you know how to get in to take the test. And it's 20% of your grade. The benchmark is 900. And you'll see your score when you take it. So you're not going to have to wait for me to put, I will eventually put your score into Canvas, but you'll see your score as soon as you finish taking the exam. And remediation is mandatory. So it'll be based on your score. So for example, between 800 and 900, I think you have to remediate for 1 hour. So as we get closer to when you take the HESI, I'll put the remediation time based on your score in the announcement section, so you kind of know what to expect. But if you don't remediate, then you don't get credit for taking your HESI. So just to know, and you don't need to, there's no screenshots, you don't need to upload anything either. This is another thing where I'm going to log in and I can see your score and I'm going to see how long you remediated. There are also case studies that are in there. You're not required to do the case studies. They're the same ones that you're going to do during class. But you do need to remediate based on the score, and it'll be an amount of time that you're required to remediate. And there will always be security. You're always going to have to show your ID. You're going to have to be on camera at all times. You're going to have your face visible. Does anyone have any questions about taking the HESI? Okay. So like I said, there will be a HESI review. And there are always exam reviews. So I just kind of keep that in mind and stay on top of the homework, do the reading, come to class, and you should be prepared. So we are going to start. We have a Kahoot to end class. I'm going to show you guys something in here. So the exam, I'm sorry, the week 1 interactive lecture that's built into your Canvas shell is pretty good. So we're gonna look at it. I'm gonna show you where to find it. I moved it so that you could find it. So we are here Friday 6 to 8. So I'm going to go into student view. So hopefully then it'll look like your computer. And under your to do, there's this one thing here that says week 1 interactive lecture. So this is information that I'm going to go over with you right now. But if you want to practice it on your own after class, this is where you would find it. It would be home, and then at the bottom of what to do, it says week 1 interactive lecture. So a lot of these interactive lectures, really, they're not necessarily that useful, but I think for week 1 that it's a very good lecture. So I'm going to go ahead and leave student view and open this the way that I normally do, but I just wanted you guys to be able to find it. Let's see here. Okay. Okay, so our introduction to pediatric nursing, we're going to talk a little bit about growth and development, types of growth patterns, developmental theorists, and we're going to do a little bit about infants and toddlers, how they grow and what you look for when you're assessing them. So this is just like a very basic overview. And if you give me 1 second, I just realized it's pretty dark in my room. I'm going to turn the light on. I'll be right back. So we're going to go over this information. This is like starting as an overview, and for a lot of this, we'll go into more information as we go on. So height and weight are checked at every well child checked, and then OFC or head circumference is checked until age 2. So height when they're able to stand, so usually after age 2, you do it when they're standing up, and then before that you lie them down. So there'll be like a board with a foot thing that moves back and forth, and that corresponds to the number of centimeters. So you'll put their feet up like this, and you'll put the board up next to it to measure their centimeters. And generally speaking, infants should be growing 1 inch per month. And it's important to kind of know these markers for growth so you can see if a baby is growing appropriately. So right when a baby is born, in that first 12 to 14 days, weight fluctuates, but you should expect a baby to be back to his birth weight by the 2-week mark. So you would be worried if a baby was born at 6 pounds, 8 ounces, and then at 2 weeks, they weren't at least 6 pounds, 8 ounces. So it's not unusual for their weight to kind of dip down and then come back up, but definitely by 2 weeks, they should be at least up to their birth weight. And then by 5 to 6 months, their weight should double. And then by a year, their weight should triple. And by 2.5 to 3 years, it should quadruple. So they grow a lot in the first year, and then it kind of starts to slow down. But it is good to kind of have these markers in your brain. So you can kind of just look at a baby's birth weight and see how old they are and see if you think they're growing appropriately. So body proportions. Do babies have big heads or do babies have small heads?
Big heads.
They have really big heads. So they do. So just to kind of remember that, they don't have the adult body proportion. They have a really big head in relation to their chest, and that kind of changes as they grow. And they have a high metabolic rate. So that means for their size, they require a lot of calories. They need a lot of nutrition and fluids. And how about respirations? Do babies breathe faster or slower than adults?
Faster.
They breathe faster.
Faster. Okay.
And how about cardiovascular heart rate? Is it faster or slower in a baby?
Faster.
Faster. And how about blood pressure?
Lower.
So when we're done with this class today, I'm going to send you an email that has PowerPoints for each chapter and the vital signs ranges by age. So yeah, it is quite a bit lower. So like a baby, a newborn could have a blood pressure of like 60/40, and that would be a normal blood pressure for a newborn, which obviously would be way too low for an adult. And how about their immune system? What do you think? Do they have a normal immune system when they're born?
Weak.
It's weak. So they do get some immunity from the pregnancy and from the mom. So there are some antibodies that pass across the placenta. So they have some of that residual antibody from mom for about 3 months, and there is some possible immunity from breast milk. So breastfed babies might have a stronger immune system. But immunizations, vaccines are really, really important for babies, and this gives them acquired immunity. So one of the reasons why we really want to make sure people are coming in for their well child checks is to make sure they get their vaccinations. So their well child checks are scheduled around their immunization time. So they should be coming in at regular intervals to get checked for their height and their weight, and also to make sure they're getting their shots. So a lot of things about babies are not fully developed when they're born, and that includes their kidneys. So you wouldn't expect their kidneys to be fully developed until age 2. So they don't have the same ability to concentrate fluid. They're higher risk for dehydration, and they are also at higher risk for drug toxicity because their kidneys aren't going to be filtering medications the same way. And then for their nervous system, obviously they're not able to do that much right when they're born, but they sort of increase with their skills and ability as they get older. So this is just kind of making you think about the nursing process when you're doing, when you're assessing babies. So data collection, this is going to be your height and your weight and milestones. And then they kind of, so the way that I always remember the nursing process is ADPI. So assessment, diagnosis, plan, implement, evaluation. So just always think about what you're doing in the nursing process. So you're going to start with your nursing diagnosis based on kind of, you're going to look at your data, come up with your nursing diagnosis, an assessment, and then you're going to plan what are you going to do based on that diagnosis, implement, and evaluate. And it's always good to always have that thought process when you're caring for a patient. And then after you get to the evaluation stage, you're going to look at your data again and see if you need to implement a new plan. So this one is just going to kind of talk about some different things, different factors that influence growth and development other than like nutrition. So, you know, heredity in terms of like where you're from, your position in the family, your gender, the environment that you live in. So when we talk about ordinal position in the family, this is like the first child versus the last child. So how many, a couple of you said you have kids. Does anyone in the class have more than one kid, have like two kids or more?
Yes. Yes.
Yeah. So how many kids, do you mind me asking, how many kids do you have?
Two.
Two. And do you think your first child spoke sooner or your second child spoke sooner?
My first one.
Your first one. And you know what? That's totally normal.
I
Yeah.
think my second one did.
Oh, that's a little bit unusual. So a lot of times the oldest kid will start speaking first. And then after you have subsequent kids, the older kids, they kind of dote on them. They always want to be with the baby and they want to help the baby and they end up talking for the baby. So then the baby doesn't talk. So this is kind of talking, this is what we talk about in terms of ordinal position. So sometimes you can see some developmental changes just based on the birth order of the child. So it's really important to know what is normal. So if a child's not meeting milestones or not growing appropriately, you can intervene early. And to remember that children are not just miniature adults. And this is kind of saying the same thing, is that intervene early, making sure that you're paying attention to what's going on. Because a lot of times they could have a developmental delay, but if you get them into the appropriate therapy, they can really learn a lot of skills that they wouldn't otherwise learn. Hey, so there's two different basic growth patterns. There's proximal distal growth and cephalcaudal. So who can tell me what cephalcaudal is? Is that head to toe or is that from the center outward?
Head to toe.
That's head to toe. So proximal distal then is from the center outward. So what's an example of head to toe growth? Like how would you see this in an infant?
Their length or their height.
Yeah, so in terms of the cephalcaudal, this would be like they have control of their head before they have control over anything else. So you'll start to see their kind of move their head before they move their trunk at all. So that's just kind of talking about like their head's really big, but they also like start moving their head before they really start moving the rest of their body. And then the proximal distal, what would be an example of proximal distal development or growth? So proximal distal, what does that mean? It means from the center out. So this would be like being able to move your upper arm before you really have ability with your fingers. So it's just talking about like what's closest to the center of your body develops before what's out in the extremity. So upper arms and upper legs, you'll see babies like move those before they really do much with their feet and their hands. So this just kind of shows you that. All right, so when children come in for pediatric well child checks, you always plot their height and their weight and then their head circumference until age 2. And there's a growth chart for boys and a different one for girls. And you're always going to be paying attention to where they are on the curve. So, you know, it's normal. It's ideal for them to be on the same curve for both height and weight. But the most important thing is that they're following their growth patterns. So you worry if they're on the 50th and they drop to the 10th, that's a problem. And you also worry if they were at the 25th and they jumped up to the 75th. The most ideal growth pattern is for them to follow along their curve and to not be below the 10th or above the 90th. So this Denver developmental screening tool is something that's used frequently in pediatric offices. And it's not an intelligence test. Sometimes parents freak out when you say that you're going to do a developmental screening tool. It's a test to just look at if they're meeting their milestones. So they could be really, really strong in one area like gross motor, but not really have good language skills. And this is a way to look at that and then give them targeted intervention if needed. So it looks at 4 different areas. So personal, social, their ability to play and interact with other children. Their fine motor skills, which is like, you know, being able to do things with a pen or a pencil and coloring and drawing. Language skills, and then gross motor. So, you know, it's just dividing up what things children should be able to do at different ages based on those 4 different areas of assessment. Okay, so Maslow's hierarchy of needs. My other class, I was like, what is this? And they said, the thing that we use to answer every test question. So sort of true. So what is this getting at? Like when we talk about Maslow, what are we like, someone summarize what Maslow is trying to say.
What's priority?
Yeah, what's the priority? So you always have to worry about what the highest priority is, and what, once that is met, then you can move on to the next priority. Right. So what is the base of this pyramid? What is the most important thing to have met for your patients?
It starts at the bottom, right?
Mm-hmm. Yeah.
It'd be self-actualization.
Well, self-actualization is actually going to go all the way up here at the top. So that's, you know, that's like if all of your other things are met, then you can have self. So the bottom part of the pyramid is going to be your
physical needs.
Yeah, and then safety, right? And then what comes next? Love and belonging or self-esteem?
Love and belonging.
It's kind of, yeah, it's kind of splitting hairs. Because right. So once you're, you know, so physiological needs. What's an example of physiological needs?
Food, water, medicine, that type of stuff. Love. Yes. Well, we got love up there, but yeah, just being able, getting your needs met.
Mm-hmm. And then how about safety? What would safety be? So I think that physiological is going to be like food, water. Safety is like housing, love and belonging, and then, you know, having a self-esteem and self-actualization, feeling like you're accomplishing what you want in life. So this just kind of, you know, so physiological, food, water, warmth, rest, safety, security, shelter. So we talked about this, but the main thing is that like you can't really worry about love and belonging when you don't have safety and physiological needs. So it's just kind of making sure that you're focusing on what the highest priority is for the patient based on what's going on in their life. So Erikson is one of the developmental theorists. We have Erikson, Piaget, and Colbert. So I'm going to give you guys the option because we're an hour in. It's about 7 p.m. and we go from 6 to 8. Do you guys want to take a 10-minute break, or do you want to go straight through and then maybe get out a little bit earlier?
That'll work.
You'd rather just go straight through?
Mm-hmm.
Okay. So for Erikson, we have these different stages. So there's something in every age group that the patient or the individual, there's a conflict to overcome. So if there's successful resolution, then you have a positive outcome. And if there's not, you have a negative. That's kind of the overall gist of Erikson. So for some reason, these buckets are in the wrong order, where they have preschool before toddler, but we're going to go in the order that a child would grow. So what's the first stage for Erikson? What stage is an infant in?
Trust and mistrust.
Trust versus mistrust. So what would make an infant trust his environment or her environment?
Getting fed.
Getting fed. What else?
Bonding.
Bonding with mom or dad, being warm, getting their diaper changed, things like that. So what is Erickson's stage for the toddler?
Autonomy versus shame and doubt.
Autonomy versus shame and doubt. Very good. So what is the main sort of struggle that parents deal with in the toddler years that they're going to be focused on when their kids
Them wanting to do everything themselves.
So that's that autonomy, right? They want to be autonomous. And the other thing is toilet training, right? Potty training happens during the toddler years. So you want to encourage their autonomy, and you don't want them to feel shame and doubt. So what are some things that you can do to help a child feel autonomous or have that sense of autonomy?
Give them their own tasks to do.
Yeah, and give them options, right? You have to wear shoes when you leave the house, but you may wear your green shoes or your tennis shoes. So a lot of times setting up an option and then letting them choose one, they're still choosing, they're still being autonomous, but at the same time, you're not constantly getting into a fight with them. Very good. And then the preschool, what is Erickson's stage for the preschool child?
With the initiative for school.
Yeah. And so what does this mean? Like, so this is like you want the kid to take initiative, to be willing to try new things. So you want to set them up for success. So this is like introducing them to new games, but new games that they can be successful at, that they're going to be able to achieve, because you want them to develop a sense of initiative. Because if they're constantly failing at something, or you're telling them they're not going to do a good job, then they're going to end up developing a sense of guilt. So then school age, is that industry versus inferiority, or is that identity versus role confusion?
Industry versus inferiority.
Yes. And what are the types of things that school age children are doing?
Peer pressure.
Yeah, this is when they're going to start to feel peer pressure, right? And they're going to be starting to play sports. They're going to develop more of like unique characteristic of things that they're good at and things that maybe they're not as good at. So in this stage, you really want to encourage them to do the things that they enjoy and that they feel like they're good at. Some kids are going to be really good at art, and some kids might be better at sports. And they don't all have to do the same thing, right? But they should do what they enjoy doing and that they're good at. And you want to foster that sense of industry. And then identity versus role confusion. This is the stage where the adolescent is gonna like move into adulthood, and they're working on their identity and forming that intimate relationship with other people. So this next theorist that we talk about is Piaget. And I'm honestly, I struggle with Piaget a little bit, but whenever I think when I tell students how to study Piaget, I always say, try to remember the age that goes with each stage, kind of memorize that, and then think about what normal behavior is for that age group. Because if you have that concept in your brain, it's easier to think about. So birth to 2 years, what is that? Which one of these 4 stages describes a baby up until age 2?
Sensory motor.
Yeah, this is your sensory motor. So when you're a baby, you're not talking, etc., but you explore the world a ton. So this is like really using your mouth, really touching everything. This is your sensory motor stage. And then your 2 to 7-year-old is what
is it
pre-operational? What can you tell me about somebody that's in the 2 to 7-year-old range? What sort of thoughts do they have? What's like a characteristic of that child in that age group?
Questioning everything.
Yeah, and they're still a little bit egocentric, right? It's still kind of a lot about them. They can also have some like fantasy. This is like the age group where they might have like imaginary friends. They might fantasize a lot about things. They're not really having like the concrete thoughts, and they're certainly not having really abstract thoughts. Okay. So then 7 to 11, which Piaget stage is that?
Formal.
I thought it was concrete. Let me see here. I don't want to be wrong. Yeah, it's actually concrete. So this is they're more concrete in their thinking. They're able to like understand more complex math questions and understand concepts of like mass and stuff like that. And then formal operations, this is when they're going to be able to do more abstract thinking. And we'll do a little bit of Piaget later on in this presentation. All right, so the other theorist that we study this week is Kohlberg, and he's the theory of moral development. And it's the same thing where they kind of put these in a weird order because it obviously goes infancy, toddler, preschool. So we'll do it in the correct order, but just to kind of note that on this slide, they're in the wrong order. So what stage is an infant in from their moral development? It's one of those ones that I think you can kind of remember it just based on the fact that infants don't really have a lot of thoughts. So it's pre-conventional. Like you're not really expecting an infant to have a moral state. And then toddler. What do you think here? And then in terms of a toddler, do they understand rules and stuff like that? Like what guides the behavior of a toddler?
Punishment and obedience.
Yeah, punishment and obedience. I'm sorry, that goes here. And then a preschooler, like as you kind of move beyond, it's not just like, am I going to get punished?
Morality. Morality.
Yeah, eventually you're going to get to morality, but
is it conventional?
Yeah, so it's this, the rules are absolute. So you start out with like, as the toddler, you don't want to do it because you don't want to get in trouble. And then a little bit more complex than that is that you're not necessarily thinking that only in punishment, but rules are black and white. Like there's never an exception to the rule. And then school age, this is when you're kind of getting more into the group think. Like you want to line up and stay quiet so that everyone can go out to recess. You're like following the rules so that the group has what they need. You're not just thinking about yourself. And then once you get beyond that, you start thinking about whether things are right or wrong. All right, so we're going to move a little bit beyond that. I'm not going to make you watch the video. A lack of adequate nutrition can lead to mental retardation. About how much of your plate should be fruits and vegetables? Half, all, 1/3, or 1/4?
1/3.
It's actually half. So we're probably not doing that. So, I think all of us and all of our patients should eat more fruits and vegetables. I mean, I don't know if that's necessarily true, but it's almost always true. So in terms of doing nutrition education with your families, a common thing to be questioned on tests and to just know is that babies under a year should either be formula fed or breastfed. They should not get cow's milk. So you can start cow's milk at age 1. And you always need to be thinking about choking hazard, making sure kids are not eating seeds or pieces of food that they could choke on. You normally start to introduce solid foods around 5 to 6 months. And who knows the food that we recommend people to start with? What's the first food most babies eat?
Rice cereal.
Rice cereal. And why do we recommend rice cereal?
In case they have allergies.
Yeah, it's very, very unlikely that they'll have an allergy. It's a very hypoallergenic food. And then when you're introducing other foods after rice cereal, how many days do you wait in between each new food?
Like 4 to 7 days.
4 to 7 days, and that's for the allergies. Yeah, very good. So we're going to do a little bit about childhood obesity, and the reason why is just to kind of remember that it's becoming more and more of a problem in our society. So it's more than doubled in the last 30 years. And in the 6 to 11 age group, it's gone from 7% of those children were obese in 1980 to 18% in 2010. And if you're an obese child, you're much more likely to be an obese adult. And obesity is, associated with high cholesterol, high blood pressure. And most cases of obesity they're not like an endocrine problem. It's usually related to diet and exercise. And then it's always good to know BMI. I will say, You don't need to know like how to calculate a BMI for any of your tests that you take in this class. But it's important to know basically what a BMI is and how to calculate it. So one of the things that we talk about in anticipatory guidance when we're teaching parents about kids is dental health. So what do you think? Baby teeth, you should start brushing them as soon as they have them. Who knows when kids should start going to the dentist?
Why?
Yeah.
Is
So
it when
they
they
should
start having teeth?
Yeah, but a lot of kids will have teeth before they're 1. You don't need to bring them in right away after their first tooth, but by age 1, they should come into the dentist. So the deciduous teeth is the fancy name for the baby teeth. They don't just part of like chewing food, but it's also part of the development of the jaw. So like paying attention to when their teeth are coming in is an indication that they're developing normally and there's not some like endocrine problem or something going on that's causing them not to have their teeth come in. So if the baby teeth are lost too early, the permanent teeth can come in poorly aligned. So at what age do the baby teeth normally start falling out?
Is it 5?
Yeah, we say 6, sometimes could be 5. There's always an age range, but around age 6, kids start to lose their teeth. Always think about like all those kids that you see, like their first grade pictures they're missing their teeth. So any sort of problem, if it's too early or too late, there could be a pathological problem that needs to be investigated. So just kind of being aware of when teeth should be coming in. So you start with the first eruption, you start cleaning them, brush before bedtime. You want to make sure you change your toothbrush every 3 months. You don't want to clean it in too hot of water. You don't want to cover it up. They could get bacteria on there and they don't want them to share the toothbrush ever. And they should go see their dentist by the time they're a year. So this is a little bit more about dental hygiene. So this is just a 50-50. We haven't talked about it. I don't expect you to necessarily know it, but the saliva in your mouth does help kill bacteria. So do you think you have increased protection from your saliva during sleep or decreased?
Decrease?
Increase?
It's actually decreased. And why do you think that is? I think it's because when you eat, you produce more saliva, right? So when you're putting stuff in your mouth, you're producing your saliva and then you're going to get some of that benefit. So this is a true false. There is no risk of cavities from allowing children to go to bed with milk or juice. Is that true or false?
False.
That's false. All righty. Okay, so a nurse knows that an 18-month-old should have how many teeth? What do you guys think? 8, 12, 18, or 26?
8.
It's actually 12.
Mm.
And it's like, just to kind of have like a basic idea. Like I said, there's a variety of different, there's an age range. You wouldn't necessarily want to like call the endocrinologist if they didn't have 12 teeth, but so these are the different types of play. So we're going to kind of talk about them briefly. So like therapeutic play would be something that you would do for a specific purpose, like in a hospital, with a therapist, with a doll or art therapy or something like that. Parallel play is going to be like this here, 2 kids that are playing next to each other, but they're not really playing with each other. Cooperative play is like a board game or something they're working together for a common goal. Group play is playing a group. Competitive play is something like competitive sports. And then fantasy play is, fantasizing, make believe, and then group sports. I think the play, it almost always is in the word, but it is important to know that like kids kind of start out with individual play and then they move into parallel play and then they'll move into cooperative play. They really don't play with other kids until they're, at preschool going into school age. All right. So to meet the needs as defined by Erickson of school-age children diagnosed with diabetes mellitus, the nurse should explain carefully to the mother the need to adhere to dietary modifications, allow the child to eat whatever they like and just administer insulin, allow the child to check their own blood sugar and administer insulin, or perform glucose checks 4 times daily and at bedtime. So if you're thinking about the child's developmental level, which one would you choose? 1, 2, 3, or 4?
The first one.
You're actually going to do this one here. So when you're thinking about the child, you want them to start developing like that sense of industry and that they can take care of themselves, they can do it on their own. So you want to start introducing them to their disease process and letting them be involved in it. So we call the growth and development milestones, the achievements called milestones, and they're also referred to as norms. So I'm sorry, just a second. So, you know, we talk about this in terms of being able to track whether or not they're meeting their milestones appropriately and intervening if they're not. So this is some more information going into more detail. So for like weight, we told you that it doubles by 6 months, triples by 1 year, and then quadruples by 2.5 to 3 years. Head and chest. So we talked about their head being really big. So the head and chest circumference are equal by 1 year. Depth perception, this is talking about their vision, starts to develop around 9 months. They start rolling over around 4 months. You would expect a 1-year-old to take independent steps, and they're born with primitive reflexes that then move on to voluntary movements. So just kind of having a basic understanding of what milestones would be for each age, and kind of having, like, I would say I would know like 2 months, 4 months, 2 months, 4 months, 8 months, a year, kind of in that area, just to think about a baby in that age range and what a baby should be doing at that point. We're going to skip over that. These are, you know, basic characteristics, reflexes that you would expect in an infant. So oral stage, they really get a lot of pleasure from sucking. So for example, if you have a baby in the hospital and they're going to have a painful procedure, you would give them a pacifier to suck on, and that really calms them down. And then the grasp reflex, when you put something in their hand, they grasp it. So that's like a, you know, a primitive reflex. And then as time goes on, they grasp things voluntarily. So prehension just refers to the ability to grasp objects between fingers and thumbs. And the parachute reflex, you'll see this when you put a baby face down, their arms will automatically go out to protect themselves. And then the pincer grasp is being able to pick something up with the index finger and a thumb, and you would expect this by the time a child's a year. And this is kind of getting back to like Erickson, infants need love and security to build trust. And that is the basic of a healthy personality. So if you don't successfully meet that trust in infancy, you're going to have a hard time developing a strong personality as you grow throughout life. So breast milk or formula, this is what you are, you know, either breast milk or formula exclusively for 6 months, and then you start introducing food. We talked about no whole milk until a year, start solid food around 5 to 6 months. We don't recommend that people mix rice cereal in the baby formula. Babies sleep for 4-hour intervals. So a lot of moms are not getting a lot of sleep. Their babies are waking up all night to feed, and that's normal, and they need to eat. And then we put infants on their back, and that's because of SIDS. So back to sleep. Nothing in the crib, always on their back, and that's to reduce the risk of sudden infant death syndrome. All right, we talked about this. The first solid food for an infant, what is it? Rice cereal, peaches, oatmeal, or barley?
Rice cereal.
Rice cereal. I'm so glad you guys were paying attention. So in that first year, you want the baby coming in at least 5 times for their well child checks. And like I said, the immunization schedule is scheduled around their well child checks. And they should come in 2 days after they've been discharged from the hospital, at 2 weeks, and then at 2, 4, 6, 9, and 12 months. So they should really be coming in frequently in that first year. And you know, you don't approach a baby the same way that you approach an adult. So you kind of do it on the baby's schedule. If you walk in, the baby's quiet, then you will go ahead and listen to their heart and lungs. And then if they were really loud and screaming, maybe you would try to calm them down, but also like look at their assessment of their skin or their belly or something while they're upset. And you need to count their respiratory rate and their heart rate for a full minute because it's not consistent. They'll speed up and slow down. So if you count for like 15 seconds and multiply by 4, you could get an inaccurate measurement. So car safety, in terms of car seats, they should be in a rear facing seat up until a year of age or 22 pounds. You want to make sure that they don't fall, baby gates, etc. Protect the stairways and pools. And then toy safety, make sure there's nothing small that they could choke. No removable parts that could easily be swallowed. And this is a lot of the education that you're going to do to parents when they come into the clinic. All right, this is a way for you guys to complete the sentences. So I'll read it out and you can let me know. Birth weight blinks by 2.5 years. What do you think?
Quadruples?
It quadruples. Very good. Rate of brain growth blank over time. So you start with a big head and then it
Slows down.
It slows down. Head and blank grow more slowly.
Trunk.
So in the musculoskeletal system, bones begin to
Ossify.
They ossify. And the protuberant abdomen, that's the big abdomen, you got like the big belly, something happens over time. What happens?
Flattens.
It flattens. So myelination of the spinal cord is complete by what age? Yeah, you guys, it's fine. We
2
can talk about it.
years.
It's 2, yeah.
2.
And then bowel and bladder is usually complete by 2.5 to 3. This is when you should, in this time range, you should expect your kid to be potty trained.
Yes.
Good job. So basically, for a toddler, they should be taking about 100 calories per kilo per day. And sometimes kids take in a lot of milk. So you need to kind of limit that to 24 ounces a day. And that's because they're not getting the correct nutrition if they're getting most of their calories from milk, and they can also develop anemia. So it's fine that they like milk, but you should really limit it to 24 ounces a day. And a good rule of thumb for serving size is that it's 1 tablespoon per year and age. So a 2-year-old, a serving size for a 2-year-old is 2 tablespoons, and a serving size for a 3-year-old is 3 tablespoons. And you want it chopped into fine pieces, but you don't want it to be a choking hazard. And offer a variety of foods. If they don't like it, that's fine. You can offer it again at a later date, but give them a variety of food options. And they tend to really like finger foods. We're talking about toddlers here. So this is you're gonna take these boxes across the top and then put them in either Piaget or Erickson. So toddlers are in the pre-operational stage, and for Erickson, they're in the autonomy versus shame and doubt. So object permanence fully developed, is that Piaget or is that Erickson?
Erickson.
It's actually Piaget. So what does object permanence mean? What does that mean? So that is, if you take something away, they remember it. So the object they have an idea when they can't see something that it still exists. So this is like, if you take their teddy bear away, then they know that they have a teddy bear. So this is something that you would expect in a toddler, that they would still look for their teddy bear after you took it away. And testing independence, is that Piaget or Erickson?
Piaget.
That one's actually going to be Erickson. This is where they're going to be constantly trying to get their independence, their autonomy established. So they're constantly going to be testing you. And then the magical thinking. You guys don't want to guess. So this one is Piaget. So, they have a lot of fantasies. Lack of conversation skills, is that Piaget or is that Erickson?
Erickson.
That one is actually Piaget.
Oh.
Yeah. So lack of conversation, they don't really have the cognitive ability to have like a big vocabulary. And then Erickson is like, me do it. They don't say much, but they're very egocentric and they want to talk about themselves. So that one kind of surprised me that, so Piaget really thinking about like thought, and then Erickson is a little bit more on the behavior side of things, but still, yeah. So, talking about their thought processes, and then Erickson, what they do. So these are some basic things, child-proof caps, making sure that the hot water is not too hot in the house. You have a smoke and carbon monoxide detector, space, the crib is not a danger to the baby. You're using the appropriate car seat. And then parents' response to temper tantrums. What should you do if a baby has or a 2-year-old has a temper tantrum? What's the best response? All of you parents out there, what did you do when your kids started screaming? You can do a timeout. You can also just ignore them and let them get over their temper tantrum. And in terms of timeout, like how long of a timeout? If you're 2, how long should you be in timeout?
5 minutes.
2 minutes.
2 minutes, 1 minute
2
per
minutes.
age.
Oh, okay.
Yeah, that's a nice way to, it's like a straightforward thing to remember. And these are all things that are like anticipatory guidance for nurses, making sure that the parents expect something that's normal for that child. Like a toddler is going to have temper tantrums. That's normal. So you need to kind of prepare parents for that. So this is going to be guidance. You're going to say if each one of these things is appropriate. So when you're teaching a parent about a toddler, should you teach them that spanking is okay?
No.
No. How about limit setting?
Yes.
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 Timeouts?
Yes.
Yes.
Maintaining consistency of expectations?
Yes.
Yes.
Rewarding good behavior?
Yes.
Yes.
Yeah. So the only thing that you're not going to do is encourage spanking. So things that toddlers like to do, they really like push-pull toys. You want to make sure the toys don't have any small pieces they can choke on. They like blocks, parallel play. So this is like they're playing with the kid, but they're playing near a kid, but they're not playing with the kid. They're very egocentric. This means it's all about themselves. Me too, me. But they start thinking, at the end of the toddler years, they're more interested in group play and stuff like that. They're starting to develop a social concept. All right, so that is the end of this, and I showed you guys where to find it. We're going to just do a quick 10-question Kahoot that I want you guys to make sure you're fully ready for your quiz next week. So I'm going to pull this up, and then when we're done with that, you guys are going to be free to go home. Well, you're already at home. Well, in class.
Some of us have class at 8.
Oh my goodness. At 8 on a Friday? That just
8 to
seems
10. 8 to 10.
Yep.
My goodness. Wow. What class do you have?
Community.
Concepts of community or community concepts, something like that.
Oh my goodness. Okay. So, here we go.
Killer.
So are we going to use our book at all? Like, should we bring our book to class, or is it more of those PowerPoint like things? I can't hear you. You're muted.
Thank you for telling me. No, I muted myself because the dogs were barking. Yeah, you don't need to bring your book to class. The PowerPoints will be what you should study off of, and the Kahoots. I'll be right back because I'm going to go tell my dogs to shut up, but I'll be right back.
Are you okay if I don't do the Kahoot? I just handed my son my phone, so I can't. You're muted still.
Yes, thank you for letting me know. But please stay in class and pay attention, and then I'll put the Kahoot in the announcement, and you can practice after class if you want to also.
I'll just write it on a piece of paper.
Okay. And then Ashley, you asked about the topics for the NCLEX. Yeah, it'll be in the instructions for what the topics that you should choose.
Okay, thank you.
You're welcome. All righty, I think we got a pretty good quorum here. All right. So the nurse explains that permanent teeth begin erupting at what age? 4 years, 6 years, 8 years, 10 years. Yep, so it's 6 years. Good job. What does self-feeding help develop in the toddler? Good nutrition, adequate height and weight, a sense of independence, or healthy teeth? Yeah, so a sense of independence, getting back to that Erickson stage of autonomy versus shame and doubt, you want to help them develop that sense of autonomy, and letting them do things like feed themselves is part of how you do that. Why is a 4-year-old likely to obey the rules? Because the child respects authority figures, the child does not want to be punished, the child wants to please others, or the child believes that following the rules is right. Yeah, so at this stage, they're still thinking about like, well, I'm not going to do it because I don't want to get in trouble. So very good. What is the earliest age at which an infant is able to sit steadily alone? 15 months, 8 months, 5 months, or 4 months? Right, so it is 8 months. So they'll kind of wobbly sit earlier, but like around 8 months, going on 9 months, they'll kind of be able to sit on their own. What is an abnormal finding in an elevation of a 6-month-old? Head leg is present, weight gain of 47 ounces per week, length increases of 1 inch in 2 months, or can sit alone for a few seconds. Yeah, so head leg is present. So head leg refers to, like, if you have a baby lying down and you pick up their hands and you pull them up, by 6 months, they should definitely be able to hold their head up as you're pulling them up. They should actually start to do this around 4 months. So if they're not doing it at 6 months, that means they don't have the normal head control for a 6-month-old. How many hours should toddlers be able to stay dry for the nurse to suggest bladder training or toilet training? For 3 hours, 1 hour, 4 hours, or 2 hours? Yeah, it's 2 hours. And what's something else? What's another characteristic that you might want to think about in terms of potty training that you might want to ask if the kid was able to do?
Explain like if he has to.
Ah, very good. Yes, they need to be able to communicate with you, and they need to be able to sense if they've wet themselves and be able to communicate what's going on. Very, very good. How many minutes should a 5-year-old be in timeout? 15 minutes, 5 minutes, 10 minutes, or 7 minutes? Right. So that's 5 minutes. Very good. Remember, it's 1 year, or I'm sorry, 1 minute per age in years. What type of family consists of 2 parents with children from a previous relationship? A blended family, a nuclear family, an alternate family, or an extended family? So that's a blended family. Very good. What's a nuclear family? Does anyone know? So nuclear family is just nobody's been divorced. It's a mom and a dad and they have kids. That's it. An extended family, what's an extended family?
Like your
Like grandma, uncle.
Mm-hmm. And then alternate is kind of a catch-all, but it could be like 2 people that aren't married that are raising a kid together, something like that. Not one of the other sort of family units. We talk most about blended, nuclear, and extended. So an infant who weighs 6 pounds, 12 ounces at birth should weigh what at 6 months? 15 pounds, 12 pounds, 13 pounds, 8 ounces, or 17 pounds? So good job. So by 6 months, what happens to the weight? Does it double or does it triple?
double.
Doubles. And the other thing you need to answer that is how many ounces are in a pound? So it's 16 ounces in a pound.
16.
Yeah. So those are the 2 things that you need to know in order to figure out, because they'll give you the weight. If they give you the weight in pounds and ounces, you would need to know how many ounces are in a pound. Good job. All right, last one. What is an example of proximal distal development? Dexterity or movement of the arms before the hands, head control before trunk control, vocalizing before forming words, or walking before running? Yeah, so this is the, thinking of the midline before the outer. So moving the arms and the upper legs before moving the hands and the feet. The head control before trunk control, that's cephalcaudal. My dogs are very excited that we have class late on Fridays nights. I'm so sorry that they've been barking. So that was the end of that one. Of the Kahoot, see our podium. All right, KGL, who is KGL?
I am. Catherine.
Catherine, great job.
Thanks.
Okay, so what you guys should expect from me. So homework is due on Sunday, so I will post your grades by Tuesday. And I will send you an email that has the PowerPoints from chapters 15, 16, and 17. And I'll also send you an email, it'll be the same email that has the normal vital signs by age. And then I'll post in the announcements the Kahoot and a link to the video. So you guys can watch this again. And then if you have any questions throughout the week, just send me a message and let me know, okay?
All right.
All right, you guys have a good Friday. For all of you that have class from 8 to 10, have a good class.
All right. Thank you.
Yep,
Thank
bye-bye.
you.
Sure.
Have a nice weekend.